My name is Lauren, and I'm doing a project on the asthma attacks in a medical office emergency situation, also done by Eleni Minji and myself. What is an asthma or an asthma attack? Asthma is the cause of inflammation and constriction of the bronchial tubes, which are the passageways where air enters and leaves the lungs. These air passages become narrow, making breathing difficult. Asthma attacks can be a terrifying experience, and those who have personally experienced an attack have stated it feels like drowning in air. An allergic response, intense mental stress, or respiratory infections are some triggers of an asthma attack. Other etiologies of an asthma attack can be from the environment or hereditary. Most children with parents who both have asthma are more likely to have asthma passed down to their children. Asthma can also be triggered in adulthood after the age of 18 or in pediatric, also called childhood asthma, and this type of asthma often begins before the age of 5 and can occur in infants and toddlers. Frequent triggers of an asthma attack are intense aromas like perfume and irritants in the air like smoke or chemicals. Additionally, allergen reactions to pet dander and other household pests can also irritate the airways. Alright, so more about asthma. More than 4,000 deaths occur due to asthma each year, and each day 30,000 people experience an asthma attack. This preventable disease makes 1,000 people go to the hospital due to asthma, and the symptoms, which occupies 1/4 of all emergency room visit of 2 million people in America. It contributes to the annual cost of nearly $18 billion, of which $10 billion are direct care and $8 billion are indirect costs. It can happen without warning and it's unpredictable, so having emergency treatment plans can prevent the symptoms that often send patients to the hospital. So, there are 4 stages of asthma attacks, which can include intermediate, mild, moderate, and severe. In most cases, intermediate asthma attacks come and go, so a patient may feel normal in between asthma flare ups. Doctors typically recommend a short acting inhaler, which is a short acting beta 2 agonist, such as Albuterol inhaler, which is one common medication used for people with asthma. The beta 2 agonist in the medication stimulates pulmonary receptors that instruct the airways to expand when inhaled. This drug begins to work within 5 minutes and can last to 3 to 6 hours. Albuterol prevents constriction of the airways, which may lead to asthma-related symptoms such as wheezing and breathing difficulties, which are often seen in mild symptoms and as well as moderate, but it can be controlled to avoid medical emergency situations, such as in the office. If you were to ever have an asthma attack, we do require having inhalers on hand, especially the medication systemic corticosteroids, which can lessen airway inflammation and may be required if symptoms worsen or are persistent, which are very obvious in moderate and severe symptoms that can be seen more throughout the day and nighttime awakenings more than 7 times per week, compared to intermediate and mild symptoms, which may not even show more than 2 days per week. So, for patients that have asthma, often doctors will provide up asthma treatment plans that will be necessary to avoid emergency situations and prevention of symptoms that can often send patients to the hospital. So, preventative medications for asthma symptoms include short-acting inhalers, rapid onset beta 2 agonist, and or anticholinergic bronchodilators, which relax airway muscles. These preventative drugs treat the airway inflammation that results in asthma-related symptoms. Asthma can be controlled with everyday regular use of medications, which can lessen or completely stop asthma attacks and require quick-acting inhalers rather than long-term medications. Patients with severe asthma symptoms should seek urgent care, particularly those accompanied by other symptoms, including intense perspiration, dizziness, nausea, panting, a fast heartbeat, and pale, chilly skin. These might indicate shock or a blood pressure decline that could be fatal without medical attention, and the patient's quality of life may be significantly impacted by asthma if it is not controlled. It can make even sleeping difficult, going to school or work difficult, exercise tolerance, and, however, consistent medication usage and disorder management can reduce the likelihood of an asthma attack. There are also two different medications that will be regular use of asthma patients, which include long term, involving medications that you take every day to control airway inflammation and prevent asthma attacks, which can be your lycotriene modifiers. Medications also include inhaled corticosteroids and long acting bronchodilators. There are also quick relief rescue medications that you can take for short term relief of asthma symptoms, and those medications are referred to as short acting bronchodilators and work to open your airways. Most often, patients with mild to moderate symptoms will use quick relief, and patients with more severe and intense symptoms will use the long term medications and have more intense treatment plans. So just to wrap everything up, the most important takeaway of our presentation is going to be that asthma can be controlled with regular use of medications and treatment plans, such as the bronchodilator inhalers and short-acting inhalers that can help with symptoms such as wheezing and coughing. Thank you.